Hello, everyone. I'm Bert Eichold, the health officer of Mobile County. I want to thank everyone for all their hard work with helping to decrease the spread of COVID 19 in Mobile County. It's having a very positive impact, wearing your mask, washing your hands, and socially distancing. Our younger generation is still getting out and about and having an increased instance of transmission in the community. So, Dr. Murphy will be talking about that. But this is now the beginning of flu immunization season, so would like to invite everyone to get their flu vaccine. I'm going to get mine today so everybody can see that we lead by example in public health. And we encourage you to get your flu vaccine from your provider of choice. If you have trouble finding the vaccine, do not hesitate to call the health department 690-8889, and we will help each and every one of you get a flu vaccine. So with that, it's my opportunity to take my flu vaccine in front of everybody.
Step over just a bit. Perfect. Big stick. 1, 2, 3. Right.
Thank you very much. Easy as 1, 2, 3. All right, Rendi.
Uh-oh, Dr. Eichold left his badge. All right, hi there, everyone. Yeah, it's flu season coming on, and flu shots are already available out there. So please go and get a flu shot, you and your whole family, especially if you are in some of those high-risk categories for severe complications when you have respiratory disease. And then if you don't have a private provider, you can call us at the health department and get a flu shot at one of our 8 clinics, 690-8889. And we'll also be having some free flu vaccination clinics. We're planning some now, too, for early November. So stay tuned on those as we continue to plan around those events to get flu vaccine out to those of you who are not able to get it through a private provider. So now I want to switch to giving you our COVID-19 update for Monday, October 12th. My name is Rendi Murphree. I am an epidemiologist and the director of disease surveillance at the Mobile County Health Department. So globally, 37,640,000 cases of COVID-19 with over 1,078,000 deaths. So really, I look at these numbers every day, and often they really startle me. In the U.S., nearly 7.8 million cases of COVID-19 with almost 215,000 deaths. And in Alabama today, 166,000 cases with 2,665 deaths. So for Mobile County today, we're reporting for the first time over 14,000 cases of COVID-19, 14,020 cases. Since we last spoke with you on Friday, we added 59 cases on Friday, 35 on Saturday, and 29 on Sunday. So this fits with the pattern that we see a rather low number of cases reported following a weekend when many healthcare facilities are closed, many laboratories are closed, and then we start to see that number sort of tick back up through the week as places report what they've done to us and then get back to business for Monday through Friday. For the number that have died, we have 312. A few have been added over the last couple of days. The cumulative number of people hospitalized with COVID-19 is 2,120. That was an increase of 5 since yesterday. And currently hospitalized with COVID-19 yesterday was around 81. So, the number for last week, the week ending October 10th, we added just 239 cases of COVID-19 that was reported through standard public health surveillance to the Alabama Department of Public Health. So we know that that is an underestimation, but it still is great to see that number staying low, going down over the past couple of weeks. Really good news to see that. Although we have to remain resilient and compliant with the Safer at Home order and the mask mandate to try to continue to slow the spread and protect those in our community that are most vulnerable. As Dr. Eichold alluded to, we nationally and particularly in the South, and what we're seeing here in lower Alabama, is that it is transmission in the younger populations that are driving community spread right now. There have been several studies published that show that the young age groups are the ones that are driving hotspots, driving community transmission. And yes, they are less likely to have severe illness, but what we see is that about a week to 14 days after we see an increase in the younger population, it is followed by an increase in disease among people 60 or older. And that is why we still are seeing a low number of cases, but our number of people hospitalized is starting to increase. A few weeks ago, we averaged around, the high 50s, low 60s. Then we started having around, mid 70s in the hospital each day. And the last couple of days going into last week, we're starting to see in the low 80s in the hospital on any given day with COVID-19. So this is reflective of what others are seeing in other areas. So it's super important that if you are in those younger age categories, that you continue to remain compliant with social distancing, with wearing a mask, with isolating yourself if you're sick. It is super important. A study published last week talked about how young adults represent an increasingly large portion of U.S. COVID-19 cases, particularly in southern states. And a study of young adults in the Midwest said that some of the perceptions with young people is that they have a low severity of disease outcome, so they're going to be asymptomatic or have mild disease. They have a perceived responsibility to others, but that doesn't necessarily translate into action, that there is peer pressure. So if they go to a party or to a restaurant, then, their friends aren't wearing masks, so why should they? And my answer to that was you should set an example, right? Set the example, be the leader, be the light, be the one that's doing the right thing to protect yourself so that you can protect those in your family who are at greatest risk. Also, conflicting messages, misinformation, opposing views, all these as drivers for the apparent apathy for wearing masks or avoiding social gatherings among young people. So please recognize that those social interactions are what we're trying to avoid. When you are out in a restaurant gathering and you may be drinking, you sort of become less aware of how close you may be getting to other people, maybe less likely to, wash your hands or to wear a face mask or to respect that 6 foot of distance from people who are not in your household. So we're just, kindly reminding you that you have a big role to play here in protecting our most vulnerable populations by continuing to adhere to the mask order and by not gathering socially to protect transmission, to reduce transmission in our community. So a little bit more about the trends in our weekly report that came out today. So our rate, the number of cases per 100,000 population overall is still sitting around 3,400, but in the age group of 18 to 24, it's 5,394 cases. Quite a large increase in the number of cases among 18 to 24-year-olds compared to other age categories. Again, our distribution by sex and race are staying similar. We know that about 2 times greater number of COVID cases are reported among African Americans than whites. We know that also holds true with deaths. But again, it can affect people of any age, any race, any sex, and we just need to make sure that those that are most vulnerable, so if you are 65 and older, or if you are any age with an underlying medical condition or immunosuppressive condition, or if you have obesity, then that would put you at greater risk of complications. So let me just look through here. So our number, if we look at the 7 and 14-day average number of cases reported, that's continuing to stay pretty flat. But when we look at the 7 and 14-day average number of hospital admissions by day, that is starting to creep up again, and that has been for the last couple of weeks. A couple of key indicators that we included, 5 times greater death rate among people 65 and over compared to the death rate among those under 65. This is something that has been well known about COVID disease, that those that are age 65 and older are at much greater risk, and the death rate among those older age groups is 15 times greater than those under 65. 95% of the patients who've died with COVID were known to have underlying medical condition, and of course, a little less than half of those are associated with long-term care facilities. We often talk about the percent positive laboratory results as an indicator, and this is still an indicator for our traditional public health surveillance system that is based primarily on PCR results reporting. There is some antigen results reporting to that system, but right now the percent positive in that system is down around 4%. I'm pleased to see that the number of tests conducted is up. It looks very nice. We're meeting our goals there, and the percent positive is quite low in our traditional surveillance. Though when we look at the percent positive in places that haven't been reporting through our standard reporting system, we sometimes see higher percent positives among the locations that are doing rapid tests. So these are the machines or the cards that are flooding the market, particularly at nursing homes and urgent cares and that sort of thing. And you can get a test result in a very short period of time. It does not require a highly complex molecular laboratory. And many of those folks are not able to report to us electronically. And we sometimes see the percent positive in those locations up above 10%, around 12 to 14%. So take a look at the map with a cumulative number of cases reported. You can see this adjusts for the population size. So we have, large areas where we have a much higher rate of COVID-19. And then, of course, we have the density map that just shows the number of cases for the last couple of weeks so that you can see if you are in one of those hot spots. All right, I'll try to wrap it up quickly here. We just have a couple of comments from members of the public. Someone left a voicemail for me today to mention that at the baseball park next to their apartment complex, there are signs around saying that masks are required to watch baseball games or to be in the park. And that person was asking why, if you are in a park, do you have to wear a mask when there are gatherings of, he mentioned 600 people or more gathering without masks. So I don't know of any large gatherings like that where 600 people not able to social distance that aren't wearing masks. And if you do know of a situation like that, please call us and let us know the specific event and where it took place and what time it was so that we can try to track that. If you know of people who are not adhering to the Safer at Home order and the mask mandate, you can send an email to iscomplaints@mchd.org. Give us the name of the business or event, the location of that event, and we will reach out to the organizers or to the owner or to the manager to try to help them understand the importance of adhering to the mask mandate and insisting on 6 feet of physical distance. And then another question from someone who asked, they had symptoms, tested negative, were told to isolate for 10 days, and now their employer is trying to force them to come back to work before the 10 days is over, and in fact the person is still symptomatic. So no, if you are symptomatic with fever and respiratory symptoms, shortness of breath, cough, those things, any of the other COVID symptoms, you should isolate at home for 10 full days regardless of your test result, and only go back to work, only discontinue isolation when you have been symptom free for at least 24 hours. Let's see, so hopefully that clears that up. And I think that's all for today. Mark is saying there's nothing else on Facebook. So again, I will just end by wishing you all a safe and healthy week. We skirted Hurricane Delta. I know that we are all happy about that, but our thoughts and prayers go out to our counterparts in Texas and Louisiana that got a lot of rain and storm damage from Hurricane Delta. And let's all work together to continue protecting Mobile County from the wrath of the COVID-19 pandemic by wearing a mask and socially distancing and washing our hands and staying at home when we're sick and cleaning high-touch surfaces. So thanks a lot. Have a good week, and we'll talk to you on Friday.